speakers come from a lot of different countries, backgrounds, cultural practices, and the way a Hispanic or Latinx person looks can't be simply narrowed down to one look, as this is a very diverse population in itself who come in different physiques and skin tones. Today we'll be focusing on the different struggles Spanish speakers have when filling out paperwork in mental health settings and ways to be effective in providing services for someone who is Latinx or Hispanic. To start off, it is very important for agencies and businesses to have forms which are translated into Spanish in order to be completely inclusive to this population. While there are forms which are already translated into Spanish, there are other situations in which forms are translated into Spanish by someone who works at an agency, which could be problematic if the Spanish speaker selected to translate the form translates it incorrectly or doesn't completely translate it to what the original form in English is asking. Some businesses and agencies depend on their staff to translate the form themselves, or in other situations have the original English form be translated verbally to the client over the phone or in person if they don't have it translated in Spanish already. While it is helpful to have clarification if someone is struggling to fill out a form, the opportunity to read it in Spanish should be offered, then the Spanish form should be reviewed if that is a selected preference by the client. A challenge to think about is that the Spanish speakers filling out the form might not fully understand some of the language, even on the Spanish form. This can be a big problem while in medical settings, as some of the language can at times be complex and the words might not be fully comprehended by the person filling out the form. It's important to always ask them if they have any questions on the form in order for them to be aware of what they are signing. Another important factor to take into account is the client's nationality, because many times in the US there is an assumption that all Spanish speakers speak the same and use the same words. This is untrue, as people from different Spanish-speaking countries have a lot of slangs, expressions, and just completely different words to explain the same thing. This can cause some trouble with the translating portion, as someone who immigrated from Argentina might not completely understand the translation to a form by someone who learned Spanish in America, or whose Spanish comes from a different Spanish-speaking country. Learning different phrases can assist with this, as there are resources online to assist your client if they are from a different Spanish-speaking country than the one you are most familiar with interacting with. Remember to always address the Spanish-speaking client using the usted form in order to be respectful, as in certain Spanish-speaking countries this is expected. When giving out forms that focus on mental health, be culturally aware and understanding of the stigmatization that comes along with these services, especially when giving out suicide risk assessments or other forms which the client might not be comfortable addressing. To recap, look for extra resources when working with Spanish speakers. Always use the usted form when addressing a Spanish-speaking client. Be culturally aware and understanding because of the cultural stigmatization, and get to know the background of the client's culture, as this can allow for better services.